Chronic stress is the usual explanation for people suffering with anxiety and depression issues. But for many people, that explanation is incomplete, and for many, it doesn't even fit. Their relationships at home are very stable. They have rewarding careers. Their finances are in order. They have no major loss or trauma or grief they're having to deal with. Now, their lives aren't perfect by any means, but there's nothing in their lives going on that explains the severity of their mental health struggles. They wake up with this crushing heaviness, this fatigue, anxiety, feeling of being overwhelmed, and constantly on edge. So if the psychological stresses aren't there, what's causing the brain chemistry issues that are leading to their anxiety and depression? The missing piece here is that stress isn't just psychological. Your life can be very calm and uneventful, but your body can be under significant physiological stress. And one of the most common hidden sources of physiological stress is chronic inflammation. In this video, we're going to explore that connection between inflammation and stress and anxiety disorders, and show how this is extremely important for people with both the psychological issues they're dealing with and for the people who don't have those issues. So let's talk about stress, anxiety, depression, and chronic inflammation. Now, everything we're going to talk about in this video was actually found in a book I've written. It's on Amazon. The link is right here. Anxiety, Depression, Inflammation Revealed. So if you'd like to learn more about the concepts and topics we're going to talk about with research supporting it, that's a good resource for you. We're also going to talk about a free guide, Food Intolerance, Allergy, or Sensitivity. We'll mention it a couple times and again at the end of the book. These are resources you can go to after the fact to remember and to go over this information again. Now, with mood issues, anxiety, depression, mental health issues, there's three common explanations that's typically used to explain the cause for these things. One, the psychological stress, stressful days, relationship issues, financial issues, trauma, abuse, and grief. Those are all very real causes that we have to consider. Nothing in this video is going to argue against that. Next are biochemical imbalances. This is where the medications tend to target. Serotonin, norepinephrine affecting drugs. Biochemical imbalances, neurotransmitter imbalances, deficiencies and excesses. These can lead down the path to mental health issues as well. And finally, it's just how you're wired. It's in my genes. My grandmother was depressed, my mother was depressed, so I'm going to be depressed. These are the three main areas that people tend to focus on in terms of what's causing their mental health struggles. Now, most people will have a combination of those. Some will have all of them. The one constant in life is chaos. So stress is a part of all of our lives. But not everyone with stress has mental health issues, anxiety, and depression. Maybe the people who have more of these issues have a greater combination of these factors. But these aren't the only factors that can contribute to this. Another extremely common one are physiological stresses. And most people don't think of stress as physiological. They think of it as psychological. We're going to talk more about that. One of the major physiological stresses that most of us have to some degree is chronic inflammation. You don't think of it as a stress, but it's a major stress on the body. And the short story for this whole video is the same systems that tend to cope with physiological stress are also the ones that help you cope with psychological stress. So that coping system is being pulled in two different directions. And if one is heavier than the other side is going to struggle. This video, we're going to focus on the inflammatory physiological stress. Again, this is not to discredit these other factors. These are very real causations for these types of issues in people. It's just in many people, they're not the only causative factor. So what this video is not about, it's not meant to be a replacement for your current therapy. Whether it's psychotherapy, cognitive behavioral therapy, work with your psychologist or your psychiatrist, it's not meant to replace any medications. This isn't invalidating someone's grief, their trauma, abuse in their past, and all those types of factors. Those are very real. The purpose of this video is to find a potentially fixable or findable or treatable physiological factor that could be influencing your mental health. The work that we talk about in this video can be done in conjunction with your current therapy. It's not meant as a replacement for it. No medication should be stopped for any reason without your doctor's help and assistance. Now, when we talk about stress, most people automatically think of as psychological stress, the things we talked about before. Trouble at work, trouble at home, finances, bills, careers, schools, work, boyfriends, girlfriends, husbands, wives, partners, etc. Those are all constant stresses in most of our lives. Chaos is a constant in a lot of our lives, but most of us have the ability to cope with it and manage it fairly well. Those are the psychological stresses we're talking about. And when it comes to inflammation, when it comes to physical symptoms, the current thinking is that the psychological stress here will lead to the physiological issues over here. Fatigue, metabolic, inflammation issues. We're proposing something different here. Physiological stress can equally impact you psychologically, and most people don't think of the arrow going in this direction. The physiological stresses, what would they be? Things like hormones, menstrual cycles, colds, flus, bugs, infections, medications that we have to take. These can be very real physiological stresses in the body, And again, the same system that tends to help cope with one will cope with the other type of stress. And the stress that we're going to focus on in this video is the chronic inflammatory type. The reason being is that inflammation can sometimes be a findable, a fixable, and a treatable stress on your body. And by dealing with that, we can take the workload off your psychological stress coping workload. We have our psychological stresses here: relationships, work, family, finances, things we talked about. We have our physiological stresses. We're going to talk more about those shortly. They can all contribute to stress, anxiety, and depression disorders. The chronic inflammation, cytokines, histamine, these things like tumor necrosis factor, interleukins, interferons, allergies with histamine. Again, these are major physiological stresses on the body up here. Well, inflammation always has a trigger. Your white blood cells run through a lock and key, mechanically driven system. So if there's a chronic inflammation there that we can remove, if we can find the trigger and remove the trigger, you can see the impact that that can have on your ability to cope with physiological stress and in turn your psychological stress. The adrenal sponge in your volcanoes. We talk about this in a video called Chronic Fatigue and Inflammation. There'll be a link in the description below for that. Think of your adrenal glands, two little glands. They sit on top of your kidneys. They look like a sponge sitting on top of the kidney. They drip various forms of adrenaline into your bloodstream all day, every day. And adrenaline in various forms has one job to do in the body. It's to suppress stress. Now, again, there's many different types of adrenaline because we have many different types of stress. We have cortisol to fight inflammation and metabolic stress, blood sugar stress. We have aldosterone, DHEA, norepinephrine, epinephrine, dopamine. We won't get into all those different compounds just yet. We're going to simplify it here. So imagine our psychological stresses over here. So adrenaline in various forms comes over here and puts caps on those little volcanoes. It pushes them down so you can appear calm, cool, and collected in your everyday life. So these physiological stresses, what are they? Well, think of a period in a woman. Twice a month, her estrogen surges and her progesterone surges. The liver, kidneys, and bowels have to clean all that hormone up month after month so the next cycle can take place. We don't have to tell a woman how big a physiological stress on her body a pregnancy is or lactation would be. Every cold, flu, bug, or infection you've ever had is an immunological stress in your body. Menopause is a physiological stress. Metabolic stress with fat burning, temperature regulation, things like that. Every medication we take has to be metabolized and broken down in your liver and cleaned out of your bloodstream. Energy requirements, but also inflammatory stresses. This is the big one we're going to talk about here. So psychologically, imagine you have an issue with a spouse. You get in a fight. So for 2 or 3 days, that little volcano erupts. Well, your adrenal glands have to come over here and push that little volcano down. You have to be calm, cool, and collected, and you have to bite your tongue to get through those couple days. And then a few days later, that argument goes away, you kiss and make up, and that stress on the adrenal gland goes away. That's not going to have a big impact on that adrenal gland. But imagine you have a poor relationship, an abusive relationship, for example. That spouse volcano can erupt not just for an hour or two, for a day or two, but that can go on for months or years in some situations. And again, your adrenal glands have to come over here and deal with that. That's basically what fight or flight would be. Well, if that little volcano erupts for days, weeks, or months, or even years, you can imagine what that's going to do to the adrenal gland here. It's going to weaken it. The other thing you can start to do, though, is to start divert and steal adrenaline from your physiological volcanoes to deal with that psychological stress. This is where psychological stress over here erupting, we can start to see physiological issues over here. So the stress in that situation doesn't cause the physiological issues. It sort of reveals them. You're robbing Peter over here to pay Paul from a psychological point of view. Now, that analogy I just gave you goes in the opposite direction as well. Imagine we have an inflammatory stress right here. And I'm talking about a chronic inflammation, chronic skin issues, lung issues, breathing issues, asthma, chronic joint issues, chronic inflammatory bowel issues. That little inflammatory volcano erupts, but it doesn't stop erupting. It's just constantly up here. But you have to appear calm, cool, and collected in your everyday life. You have other things you have to do and get through. So what happens is your adrenal glands will come over here and have to manage that chronically. So what can that do over a long period of time to your adrenal gland point of view? This is where we can start to have lack of adrenaline issues. Adrenal insufficiency or adrenal fatigue would be the alternative or complementary term for this. So think of too much adrenaline, think what the opposite of that would be. Fatigue and exhaustion, but also anxiety. Where that can happen is if we have a chronic inflammation over here, we can start to steal adrenaline from our stress coping abilities. So a chronic inflammatory stuff erupting over here, we can start to have little things become big things. Mountains over molehills, edgy, irritable, overreactive. This is where anxiety and things like that can start to enter the picture. But in that scenario, the big difference, it's the physiological stress that led to the psychological issues. Most people think of stress as psychological, and that leads to the physiological. This can go in both directions, and quite often it goes through our adrenal gland system. To summarize that though, there is a physiological connection between coping with psychological stress and physiological stress. And that's what we're going to talk more about in this video. So with chronic inflammation, it's not by mistake. Your immune system, as I mentioned before, it's mechanically driven. White blood cells don't think. They interact with things, they assess things, and they determine if they're allowed or not allowed in your body. So something will set the immune system off. Quite often we think of viruses, bacteria, infections, and things like that. The immune response happens, at least inflammation. This clears the threat. And then once that threat is gone, once the infection's gone, the virus is gone, the inflammation goes away. So the immune system turns on and turns off in response to that trigger. The big difference we see here is with a chronic inflammatory food reaction, that trigger never turns off. We tend to eat that food day after day after day. So the immune response doesn't turn off. This is what leads to the chronic inflammation. It's imagine like you get a new virus every day, and your immune system has to fight that virus every day. Well, we can have the exact same immune response, antibodies and cytokines, to foods that we can eat every day. And there's some reasons why we don't figure those out. We're going to talk about that shortly. So again, the usual model suggests that it's stress that leads to inflammation, leads to mood issues and things like that. We're just proposing something different, is that chronic inflammatory food issues can lead to the inflammation issues and mood issues. Why this is important to know, in the intro, we talked about people who don't have psychological factors to the degree that it should cause mental health struggles. Well, in the food model right here, there's no psychological factors involved in this little equation that we talked about. This is where people can get into some trouble, where they're just focusing on treating psychological issues without addressing underlying physiological issues. So addressing chronic inflammatory issues can have a big impact in terms of the outcomes for mental health struggles. The best treatment actually requires both. I'm a huge proponent of psychotherapy, counseling, psychological work. I think the only crazy people out there are the people who don't go see people preventatively. We all have ologists for all kinds of parts of our body. Urologist, dermatologist, gastroenterologist, gynecologist. If a doctor says go see one of those specialists, we don't think anything about it. We just go. But when people mention the word psychologist, a lot of walls start to go up. We don't like to think of ourselves as having mental health issues or being mentally weak. Well, the most important organ in our body is our brain. Nothing else can work without that. So that should be one of the most important organs that we do preventative maintenance on. So I'm a huge proponent of psychological work. That being said, and with the work that I'm talking about in this video, there are limitations to that. You can have the best diet, hormones, sleep, supplements, genetics, but if you have really poor psychological coping skills, the psychological stress will just drain your physiology. So the inflammatory stuff that I'm talking about here isn't the total answer, but that goes in reverse as well. You can have the best psychotherapists, the best counselors, the best home life, the best support network with your friends. But if you have a physiological problem going on, you can talk to someone till the cows come home, but that won't go and make you not allergic to a food. It can't correct a nutrient deficiency. It can't sometimes correct neurotransmitter imbalances. So we need the physiological work along with the psychological work. This video is going to focus on the physiological side of things. Now, from a physiological point of view, many people come in and say, look at my blood work, it's normal. And then when I start mentioning and talking about inflammation, they say, well, I've been tested for inflammation, nothing shows up. There's a few reasons for that. The routine blood panels that people typically get done don't assess for things like cytokines and histamine and things like that. Those are the terms that we're going to be talking about here shortly. So quite often these compounds aren't tested for. Inflammatory markers like CRP and ESR, sedimentation rate, they can come back normal on a test and you can still have inflammation. There are lots of conditions out there where those markers come back normal when people are being treated for inflammatory conditions. Asthma would be a good example. People are given steroid puffers for asthma, which is an anti-inflammatory therapy. People with psoriasis get given steroid creams, which is an anti-inflammatory cream. People with inflammatory muscle and joint issues that test negative for rheumatoid, they're given NSAID medications to treat the inflammation. So just because you have a negative inflammatory marker doesn't mean that inflammation isn't part of your puzzle. And people say, well, from a food point of view, I had allergy testing done, it didn't show anything. Well, a lot of the issues that we're going to talk about from an inflammation point of view have to do with cytokines associated with a different type of allergy. The skin prick allergy, those are allergies for IgE, histamine, mast cell reactivity. That's a completely different class of allergy than the allergy that produces cytokines. And a lot of the mechanisms we're going to talk about are cytokine-based. So an allergy test can sometimes come back and tell you you're not allergic to a food when you can still have an inflammatory type of reaction to the food. It's just a different type of inflammatory reaction. And as we said before with the cytokines, there are no medically validated or clinically available tests your doctor can do for norepinephrine in the system or serotonin in the system. So our tests can come back looking pretty normal, but there can still be physiological issues going on. So what turns the inflammation on? Like I've said before, inflammation is triggered by your immune system. A big part of the immune system that does that are the white blood cells. They're the generals of your immune system. They go through your body, look for foreign invaders or attacking your body. These are white blood cells. They're receptor based. They have little arms with receptors on the end. It's like an arm with your hand on the end. These little receptors bounce into things in your body. They touch things, and they can determine what's allowed or not allowed in your body by how they feel. So it's kind of like a key going into a lock. The allergen would be the key, the receptor would be the lock, and you need a key to go into the lock to turn on the inflammation response. Why this is important to know is many people think when they hear of inflammation, it's caused by stress. It tends to be a catch-all term. Well, to say that stress could turn on this inflammatory response, you'd be suggesting that a white blood cell receptor could bind to a thought in your head. That can happen. So what stress can do, it can fan the fire, it can feed the fire, it can pour oxygen and gasoline on the fire, but typically it doesn't light the fire. So stress does have significant impacts on inflammation, but quite often it's not a causative association. Why this is important to know, I've said a couple times already, inflammation has a trigger. And if we can identify that trigger and remove it, hopefully we can turn off that inflammatory response. So how does inflammation reach the brain? So over here, we have allergens, bacteria, viruses, vaccines, for example, or food issues that we're talking about in this video. Those are antigens, or another term for allergen. They interact with the immune system. That interaction is extremely complex. It involves antigen-presenting cells, dendritic cells, macrophages, all these different types of immune cells. It's far beyond the scope of this video. Just know that the end result of a lot of that is the production of T cells, interacting with B cells and mast cells. Now, these specific parts of the immune system are what ultimately lead to the production of what we call cytokines, which are sort of slow, it's associated with slow burn inflammation. These are inflammatory chemicals or messengers that go through the body. They're associated with antibodies, which are the little soldiers that go through the body and target tissues to be affected. And it's associated with histamine, which most people recognize as the allergy compound. That's why we take antihistamines for seasonal allergy issues. Histamine is associated with short, rapid-acting inflammation. The cytokines are sort of slow-acting inflammation up here. It's these compounds here, the histamine, the cytokines, that can actually cross up through the blood-brain barrier. Sometimes it's through what we call the vagal nerve, and they can get in and interact with neurotransmitters and neural function in the brain. This is how inflammatory reactions that can happen in our body or in our gut can actually transfer up into the brain and affect us psychologically. Sleep, mood, energy, motivation, etc. can all be affected through this mechanism. Two common presentations of this mood issue with inflammatory problems. One would be the fast episodes. These are often associated with a compound called histamine. Histamine is the allergy compound. A kid eats a peanut, their throat swells up because histamine gets released. That histamine breaks down very rapidly as well. So if the kid doesn't get an epinephrine shot, their throat will typically settle down within a matter of hours. So these types of episodes, they're fast, they happen very quickly, they're very acute and sharp, they can be very significant, but they can also recover fairly quickly as well. So we can have mood issues that sort of correlate to that as well. Sometimes when people are going along fine and then right out of the blue, they can go into very deep, dark holes from a depression point of view or an anxiety point of view, associated with fear and all kinds of other psychological issues. And then they'll find themselves a few hours later, they snap up out of it. And there's no reason for it. It can happen in the middle of the day. It's not sometimes associated with any event, any psychological aspect of their lives. It just appears and disappears very, very quickly. These are the fast presentations. Then there is the slow version of this. This is more when people, they wake up tired and exhausted and anxious and depressed. And it's kind of a slow burn all the way through the day. And then the same thing happens the next day and the next day and the next day. These are often associated more with the cytokines, which we talked about in the previous slide as being the slow burn compound. When people flare with this, quite often it's not for a matter of hours, it's usually for a matter of days to weeks, and sometimes extended into months and sometimes years. This would be the more classic pattern of anxiety and depression that most people think of with respect to their mental health. The physiology behind these two different types of reactions is really interesting, and we're going to talk more about that shortly. So the cytokines that we've been talking about with this slow burn type of reaction, the fact that they can impact us psychologically isn't really theory, and it's been researched and researchers supported it. A couple studies to show this. Some of these cytokines, one specifically interferon and interleukin-2, they're common treatments for things like hepatitis and some cancers, more so in the past. Well, the study outlined here found that about 45% of patients on that study developed a major depressive episode after that therapy that they had no history of before. A direct correlation between these inflammatory cytokines and depressive mood issues. Another study in the sort of same line of thinking. Healthy volunteers were given an inflammatory injection of some of these cytokines, and they were monitored. Anxiety rose within 1 to 2 hours, with low mood followed in about 3 to 4 hours. The more cytokines that were released, the stronger the mood drop. So another direct correlation between cytokines and inflammation in the body with mood issues. Lowering the inflammation can actually help, and there are studies to support this as well. 618 psoriasis patients were put on a tumor necrosis blocker. These are the biological drugs that you see advertised on television a lot lately, but often they're for inflammatory bowel diseases, skin issues, inflammatory arthritis, and things like that. They work by blocking these inflammatory cytokines that we're talking about. Well, 618 patients with psoriasis, an inflammatory skin condition, they were split up. Some of those patients were actually given one of these biological drugs to block the tumor necrosis factor, and another group was given a placebo. The patients given the cytokine blocking medication saw greater improvements in their mood and anxiety issues than the placebo group did. This study relates to the one I just mentioned. So by raising inflammatory cytokines in the body, we saw a worsening mood with respect to anxiety and depression issues. By targeting and treating those inflammatory cytokines, we saw improvements in the mood. The results are pretty clear there. There's another way we can talk about this. You've actually felt this with the flu. When you get an infection or a virus, your immune system goes and produces antibodies and cytokines to basically cook out, target, and get rid of the virus. Well, there's something called sickness behavior with the flu. These cytokines go to the brain, and they are what tell your brain to slow down. It tells you to be tired. It tells you to go and rest. It tries to turn off your brain because that is part of the recovery process from that infection. Part of that recovery process is a low mood. So you can actually think of the low mood as part of the recovery process, not a side effect of the infection. Now, 4 key compounds when we're talking about mood with anxiety and depression issues. The one most people are aware of would be serotonin, sort of people refer to as the happy, sad neurotransmitter. Calm, steady mood. It affects sadness and despondency and despair. It's the happy neurotransmitter. It also has a major role to play in other parts of the body, especially the digestive tract. Another one would be dopamine. This is sort of the drive, reward, the enjoyment we get out of activities we like to do. Issues with this can sort of create apathy and indifference and things like that. The next one is norepinephrine. This is sort of your alertness and your threat responsiveness neurotransmitter. When it runs high, when stress is there, it's what can put you on edge, make you anxious, make you worry, have racing thoughts and things like that. The next one is epinephrine, and this is what a lot of people think of when they hear of adrenaline issues. Someone has an anaphylactic peanut reaction, they get an epinephrine shot. It's one of your major body's antihistamine hormones, but it's also an alert hormone along with norepinephrine. When we get a surge of epinephrine, we can start to get racing heart, palpitations, increased breathing rate, and things like that. Now, physiologically, there's something that ties all of these together. Inflammation can act on all of them, and that's what we're going to talk about next. So serotonin, people have heard of tryptophan in terms of boosting serotonin quite often. Tryptophan would be the old wives' tale of drink a glass of warm milk or eat turkey. That's why you get sleepy afterwards, because their food's high in tryptophan. Well, tryptophan leads to serotonin. Serotonin then leads to melatonin. So this is where some sleep issues can start to happen. Well, inflammation right here can lead to a diversion of tryptophan down a pathway called quinolic acid. This leads to what do we call increased glutamate signaling. Glutamate would be one of these excitatory neurotransmitters in the brain. It leads down this pathway to being wired, anxious, irritable. But the more important point here is it diverts tryptophan away from this pathway up here. This pathway is what leads to serotonin synthesis. So if we have tryptophan being pushed down this pathway, we have less serotonin being produced up here. So inflammation can lead to a diversion of tryptophan down a non-serotonin pathway. Now, what I don't want people to do is to go out and buy tryptophan and versions of it like 5-hydroxytryptophan to fix this problem. There's many other aspects to anxiety and depression. The other concern is that 5-hydroxytryptophan and tryptophan supplements can negatively impact conventional medical therapies, especially prescription medications for anxiety and depression. It can cause some very serious issues. So if you are on a prescription and you're thinking of these sorts of things, you have to talk with a physician first to make sure that there's no negative interactions. Inflammation can affect dopamine levels through a bunch of different pathways. Simple oxidative stress, inflammatory stress, for example, can lead to less L-dopa being produced, which can then lead to a decreased dopamine synthesis. These pathways are a little more complicated, but we'll simplify it here. Inflammatory cytokines can lead to less dopamine being stored in the end of the nerve cell. And as dopamine is one of these neurotransmitters, has to cross that nerve cell to complete a circuit. It's like touching two wires together. So it can lead to less dopamine being stored and thus less dopamine being released in response to what it's supposed to be released for. Another aspect here is these cytokines can actually lead to more rapid uptake of dopamine back into the cell it was released from. What that means is that there's less dopamine in the synapse between the two nerve cells to help transmit signals. So again, a lessening of the dopamine effect. The effects of this low dopamine synthesis or function, motivation issues, a lack of pleasure and interest in things that we normally like to enjoy, fatigue, slower thinking, everything feels harder. And you can see how all of those things can be a significant part of our anxiety or depression symptom picture. Inflammatory cytokines can contribute to all these pathways leading to this impact over here. Inflammatory cytokines can impact norepinephrine levels as well. Norepinephrine and epinephrine are actually made from dopamine. So with what we talked about before, with the oxidative stress affecting L-DOPA levels, that can also impact norepinephrine levels and epinephrine levels. This is actually fairly complicated. We'll try and simplify it. Something called the locus coeruleus, it's a little pack of neurons in the brainstem. It's what releases norepinephrine. And norepinephrine is one of these neurotransmitters we need to manage alertness and threat response and things like that. The inflammatory cytokines can start to impact how this locus coeruleus releases the neurotransmitter, releases the norepinephrine. So we can start to get irregular highs and lows. So this can lead to a combination of hypervigilance, worry, irritability if it's too high. It can lead to low alertness, poor focus, concentration, brain fog, and fatigue if it's too low. So an inflammation in that part of the brainstem can actually sort of lead to a bit of a roller coaster that way. With everything we just talked about, really all you need to know is that this inflammatory cytokine can impact all these pathways. These inflammatory cytokines are typically produced in response to something, and that's what we'd like to try and figure out. So this is another combination of things we typically hear from patients. I'm exhausted, but I'm wired and I can't relax. I'm wired and tired. So think of this. If dopamine goes down in response to these inflammatory cytokines, this is where sort of the fatigue and apathy and lack of interest in things can happen. The inflammation can also cause a norepinephrine excess to happen. So this puts us on alert mode. We're wired, we're ready for a threat. So we're exhausted and we're wired at the same time. The same inflammatory process can affect both neurotransmitters and lead to both types of symptom pictures. The chronic inflammation can put a strain on our cortisol system. Think of cortisol as an anti-inflammatory hormone. Well, that can come back and make the inflammation problem worse that led to these two pathways right here. So there's a feedback loop here. Motivation and drive go down, alertness and vigilance goes up, and the anti-inflammatory effect weakens. So the loop cycles back up to here. And all of the pathways we're talking about, again, it's that inflammatory process at the start that we're talking about. Now, anxiety and depression typically get talked about together. Sometimes people think they're the same condition. Well, physiologically, they can actually be quite different. This is the little exercise I do with patients in office. It's not a medically validated assessment tool. It's just something I use to sort of sort through the differences between an anxiety picture and a depression picture. Imagine two hands. In one hand, you have anxiety, worry, fear, panic, overwhelmed, overreactive, edgy, irritable. And then way over here in this hand, we have words like sad, despondent, despair, hopeless, dark, gloomy. And there's a big spectrum in between. Now, most people who are struggling have some combination of both of those things. And what I ask people to do is tell me which side you're on. What percentage are you? A lot of people say they're 80, 90% in the anxiety realm. Well, why that matters, with everything we've talked about before, we tend to think of the anxiety, the worry, the fear, the panic, the threat response neurotransmitters and compounds were the catecholamines, epinephrine, norepinephrine, and dopamine. The other hand over here, the sad, despondent, despair stuff, that tends to be more the depression stuff, so serotonin predominantly. Now again, most people have a combination, but quite often we'll see people with a 90% anxiety picture and they're being given a serotonin medication. And this is sometimes where the medications maybe don't hit the mark completely for people. So sometimes we have to do a little bit deeper assessment to figure out if someone's more anxious or more depressed, or if it's pretty much a 50-50 combination. That can actually impact how we assess and treat these conditions. So these inflammation and mood feedback loops. Chronic inflammation can lead to low mood, high anxiety. That can lead to fatigue and exhaustion. Chronic inflammation can directly lead to fatigue and exhaustion. That can come back up here and lead to low mood and high anxiety. Chronic inflammation can lead to poor sleep, which can lead to fatigue and exhaustion, which can contribute to mood and anxiety issues. Fatigue and exhaustion can come back and make chronic inflammation worse. Poor sleep can come back and make chronic inflammation worse. So you see how these things all feed each other. So once that cycle starts, it can start to spin down. It's like a negative feedback loop that goes down and down and down. When we have all these different potential contributing factors, we have to look at one that tends to affect the most. And quite often that's the chronic inflammation stuff right here. Now, I mentioned before, we have a video specifically on the chronic fatigue and exhaustion and how it relates to the adrenal glands. We also have a separate video on inflammation and sleep issues. So I'm going to leave links to those in the description below as well. Now, one more important disclaimer. Racing heart, pounding heart, chest pain, shortness of breath, fainting, don't perceive those as being fast histamine reactions necessarily. We have to see a doctor for those. There can be heart issues there. There can be acute anaphylactic histamine reactions we have to consider. The stuff I'm talking about in this video is for when all that bad stuff has been ruled out. So don't ignore those types of symptoms. Other factors here that we haven't talked about: bereavement, grief, postpartum depression, thyroid disease, alcohol, substances, and things like this. Those are all real contributors as well. We're just focused on the inflammatory stuff in this video. And we only focus on those inflammatory food issues once we have ruled and treated all those other factors. So how the medications work and how they sometimes impact part of the problem. And what I'm talking about here isn't an argument against medications. These medications can be life-saving for people. I am not opposed to these medications. I don't try and counsel people off those medications. It's just sometimes people don't get full effect with the medications. We're going to talk about some reasons why that can happen here. And the first obvious one is that these antidepressants tend to work downstream of an inflammatory process for some people. If the inflammation keeps being produced, the strain on the neurotransmitters below it will tend to go on. So if we take a medication to potentiate a certain neurotransmitter, but we don't address what led to the deficiency or the breakdown of that neurotransmitter, it's like you're trying to pour stuff into a bucket and there's a hole in the bottom of the bucket. So by addressing some of these inflammatory issues, we can actually potentiate the effectiveness of the medications. And inflammation, again, it's not a factor in every anxiety and depression case, but for those where it is a factor, it's often a findable and a treatable one that we can manage without altering medications and other therapies, and sometimes one that can provide big benefits in terms of making us feel better. Inflammation always has a trigger. So what the reuptake inhibitors actually do, this is a very simplified version. We have one nerve here, we have an action potential or signal, a happy signal, we'll say, coming down the nerve cell. It has to jump across a space called the synapse and touch the other neuron. The neurotransmitters are the compounds that carry the signal from one cell to the next cell. So let's talk about serotonin here. Serotonin, the signal comes down, the serotonin gets released from these little vesicles, it comes across, and it binds to a serotonin receptor right here. That's what completes the circuit and completes the thought process. Then that serotonin comes back over here, and it has to be taken back up into that cell so it can repeat the process over and over and over again. The medications don't raise your serotonin levels. What the medications do is they impair the function of this transporter enzyme right here. So what the medications do, they don't actually raise your serotonin. They make the serotonin stay in the synapse longer, so it can do its job for a longer period of time. It's not raising the serotonin, it's just making it work better and making it work longer. So if there's an inflammatory process going on that's leading to a breakdown or a deficiency in any of these neurotransmitters, the medications are very helpful, but they don't address that inflammatory process that's leading to the neurotransmitter problem. So sometimes this can be why the medications sometimes may lose their effectiveness over a long period of time, or why they don't completely resolve a symptom picture. If we apply the inflammatory process in those specific cases, it can make the medications work a whole lot better in some cases. Now, hormones matter as well, and how they carry inflammation with them. So issues with insulin sensitivity, insulin resistance, for example, blood sugar highs and blood sugar lows, not just diabetic ones, but reactive hypoglycemia, for instance, can all carry low mood as a symptom picture with it. Low thyroid, one of the most common symptoms with low thyroid or underactive thyroid, can be low mood and depression issues. Hormone imbalances with the menstrual cycle, estrogen-progesterone ratios at different times in the cycle, all can carry mood issues with it. Now, inflammation can be a part of all of these things. I have a book on insulin resistance called Weight Loss Resistance. It shows how inflammation can be tied to insulin resistance related to type 1 and type 2 diabetes, actually. Those all come with a low mood as a potential impact from that condition. Hormone imbalances, menstrual imbalances, but also menopausal imbalances. There's a video on this and a book. Menopause isn't the cause, it's inflammation. These hormones aren't just sex hormones, they're also anti-inflammatory hormones. And as these hormones fall through our 40s and 50s, the inflammation tends to rise. Most people attribute those things as menopausal symptoms. Quite often they're inflammatory symptoms that menopause allowed to come to the surface. Thyroid, for example, Hashimoto's, is an autoimmune condition or an inflammatory condition by definition. Inflammation can affect the conversion of what's called T4 to active T3. So we can have normal blood tests for thyroid, but we can actually be hypofunctioning in that regard. And again, that can impact mood. So all of these other things can matter as well, but some of them can have inflammatory processes associated with it. In clinic, depression and anxiety very rarely show up just as a single factor that the patient wants to work on. Quite often, there's going to be bowel issues, skin issues, breathing issues, chronic infection issues, urinary tract or yeast infection, things like that. These cytokines that travel through the body, get up into the brain and affect the neurochemistry up there. These are the same cytokines that can actually go and affect the skin and the joints and the bowels. That's why those biological drugs that target those cytokines treated those conditions, but some of the studies showed it also improved mood. So when we have an inflammation affecting one part of the body, quite often it's going to affect us in all parts of the body or many different parts of the body. So one thing you can consider is when I started having depression issues, was there something else from an inflammatory point of view going on at the same time? Have I had long-standing bowel troubles? Have I had long-standing bowel troubles or muscle and joint issues or skin issues or asthma? If you started to have depression and anxiety as a child, what was your health history like as a child? Did you have ear infections, sore throats, tonsil problems, and things like that? There can be a correlation there. So this inflammatory thread can actually tie low mood, anxiety, depression issues to some of your other health conditions. So where is this inflammation coming from? For many people, it's not a separate health condition. For many people, it can be a food issue. And that's what we're going to talk about next. Now, when we talk about food reactions, most people hear the term food intolerance, food allergy, food sensitivity, and they think they're kind of interchangeable. They're synonymous with each other. Well, they're not. They're technically very different food reactions. Food intolerances are non-inflammatory food reactions. They don't involve the immune system. Lactose intolerance with milk. Someone drinks lactose. They don't absorb it in the small bowel. That lactose molecule goes to the large bowel. The large bowel is filled with yeast and bacteria, and it ferments that lactose, that milk sugar. It causes gas and fluid production, and we have to poop all that gas and fluid out. There was no direct immune involvement there. We ate a food, we didn't absorb it here, it fermented way down in the bowel, and we had to poop out the fermentation byproduct. Food intolerances typically don't involve the immune system, they don't cause inflammation. Food allergies and food sensitivities are inflammatory reactions to foods. They do involve the immune system. Food allergies are the immediate type. These are the ones associated with histamine. These are the quick responses that we talked about. That would be the anaphylactic reaction we talked about. But the other type of allergy that most people don't realize exists are food sensitivities. They are just a different type of allergy. They involve different antibodies called IgG and IgA, and they cause inflammation through antibodies and cytokines. And we've been talking a lot about cytokines in this video so far. So we could spend a whole video just talking about these. At some point, I probably will do a video on those. But for now, that's where this guide comes in that I talked about before. This guide talks about the technical differences between these different types of food reactions. And from an inflammatory point of view, it talks about the differences between immediate allergens and delayed ones. And it's the delayed ones that tend to cause all the problems here. We're going to talk about that shortly here. So how food becomes inflammation. Inflammatory food reactions, again, are immune reactions. We have a white blood cell here. The white blood cells have receptors on them, these arms with feelers on the end. That's what touches things in the body and determines what it's going to react against. These white blood cells are programmed to bind to certain shapes of proteins. The shape and structure of these proteins is extremely complex. We're just going to simplify it and call them different types of shapes here. One receptor might bind to this circle right here, another one, this one right here, another one right here. You can see how they're all different. Well, our genes and DNA determine the shape of the receptors right here, which determines what we're going to be reactive to. The shape of those white blood cell receptors, the locks that we talked about, that's coded by your genes and DNA, and that's going to be different for all of us. That determines which foods will be inflammatory for you and which foods won't. These receptors are not programmed by the internet or by YouTube or TikTok or Instagram. They're not determined by a book. They're not determined by your favorite online health guru. So this is where these generic diet programs sometimes fail to hit the mark. Just because the internet or a book or an online program says a food is healthy for you and another food is inflammatory for you, doesn't mean your immune system is going to react that way. The ideal diet for you is unique to you and you alone. There's a really important video I encourage people to watch. It's called The Trouble with All Anti-Inflammatory Diets. It talks about the specific programming with our genes and DNA, and it shows examples of where people were eating healthy foods and they weren't feeling well, and how many people with the same condition can have two completely different food profiles. So there is an anti-inflammatory diet for you. It's unique to you and you alone. That's the key to figuring all this stuff out. Histamine, the fast pathway. These are these fast allergic histamine type reactions. Anaphylaxis would be the classic example of that. Histamine in the brain is the wake and alert signal. You can think of that as when people take antihistamines, it can make them drowsy. Well, histamine would make you not drowsy. It would waken you up. There's an enzyme called diamine oxidase, and this actually breaks histamine down in the body. So when we talk about histamine tolerance, no one is actually tolerant to histamine. Histamine is an inflammatory compound in all of us. It's just some of us have more exaggerated responses to histamine. This is usually a function of some people clear histamine better from their systems than others do. That's only part of the equation, though. Some people have more reactions that produce histamine. That's where the food can come in. So where does it come from? Histamine in our foods is actually not that high. There's all kinds of low histamine diets on the internet. Well, quite often, those can be misleading. Most foods don't have much histamine in them, but there are some examples. Aged cheeses and fermented alcohols. Histamine is a byproduct of the fermentation process for beer, wine, and cider. Some cured meats are high in histamine. This is a big one. Histamine can be released into the system in response to a mast cell reacting against something. This is where you can have a food that has low or no histamine, but if you have an immune reaction to it, the mast cell will break open and release histamine in the tissues. Mast cells are little balloons filled with histamine all through your body. Well, something breaks them open, it'll release that histamine into the tissues and cause an inflammatory histamine response. That histamine response also goes through the circulatory system. That's where it can start to affect brain chemistry. Another major source is our gut flora. When our gut flora gets out of balance, so part of the fermentation process in our gut can produce histamine. That can enter the bloodstream and that can affect our brain chemistry, but also tissues and issues elsewhere in the body. So earlier we talked about the fast surges from a mood point of view. Imagine we eat a food and we have a massive histamine response to it. Well, your body's response to that will be to pump out epinephrine to fight that histamine. And what does epinephrine do to heart rate? It can raise your heart rate, palpitations, racing heart. It can cause anxiety and alertness and things like that. So some of those fast surges we talked about earlier can actually be short-lasting histamine responses to something we ate. So something to consider there would be, do these episodes happen after you eat? You can start to track what you ate just before that. Histamine can overstimulate the nervous system. It can actually lower compounds like serotonin and GABA that can offset some of these fast excitatory responses that we have. GABA actually offsets dopamine. So if dopamine goes too high, GABA is meant to calm it down. Well, histamine can actually lower GABA, which can take the dopamine excitatory state and make it worse. High histamine is also associated with things like flushing and dizziness, brain fog, shortness of breath, sleep issues, and things like that. All of those things I just listed are actually common symptoms associated with mental health issues. So histamine, from an inflammatory contributor point of view, can play a major role in terms of anxiety and depression issues. These fast surges, they can be episodic, they can come on quickly. They're associated with a racing heart, flushing, palpitations, and things like that. And they can resolve sometimes just as quickly as they happened. Now, again, a really important disclaimer here. If you are having those types of episodes, you need to have them checked out medically first. We need to rule out cardiac issues and things like that. This discussion is for when those things have been ruled out. That's really important. Now, the slow pathway, this is where things get confusing for people. This is the pathway that leads to antibodies and cytokine production. To explain it, we'll talk about vaccines for a minute. When someone gets a vaccine, they get a tiny little dose like this, a small little dose. The white blood cells interact with it and they produce a massive immune response. So someone gets injected with a vaccine, various cells, dendritic cells, macrophages, B cells, that complex interaction we mentioned earlier, they ultimately lead to the production of antibodies and cytokines. Now, an important thing here is with these vaccine responses, it's only a tiny little dose that can lead to a millionfold antibody response. An antibody response to a vaccine like tetanus can actually last 7 to 10 years. So this much can produce a millionfold response that lasts for a long, long time. And another critical point here is when you get the vaccine today, it can take 2 to 4 weeks for the antibodies to get produced. So if you go on a trip somewhere, you have to have a shot before you go. You have to have it 2 to 4 weeks before you travel. Why are we talking about this? Well, the same way you can react that way to a vaccine, you can react that way to a food. And this is where the confusion happens. So the delayed reactions. First, we'll talk about a histamine reaction. You eat a food right here. The response, the histamine will rise really quickly and break down fairly quickly. This would be the IgE immediate histamine response we talked about. The delayed response, you can eat a food right here. The antibody can take up to 2 to 4 weeks to reach its peak like that, and then it'll break down very slowly over weeks to months, just like the vaccine antibodies do. Well, with chronic inflammatory issues, it's this antibody that can actually cause the problem. What that means is you could eat a food right here. You may not have a symptom to here, here, or here. So if you eat a food on a Monday and the antibodies take 3 to 4 or 5 days to get produced and in your tissues, and you get a sore joint or a red rash, you're not going to correlate the rash on a Friday to a food you ate on a Monday. This is where the confusion happens. We tend to think, what did I eat right before the symptom happened? So these reactions compound as well. If you eat a food here and the antibodies don't cause a symptom for 3 or 4 or 5 days right here, You're not going to correlate those two things. So what are you going to do tomorrow? You're going to eat that food again. And every day you do that, the antibodies don't rise from zero, they compound. They build up on top of each other like this. This can lead to a low-grade or high-grade chronic inflammatory response that never goes away. And you'll never correlate it back to that food you ate because of that initial delay. So that food will stay in your diet, it'll ebb and flow, and your symptoms will ebb and flow in a delayed manner after that. These are the reactions that tend to confuse people. Now, many people say to me with the histamine reactions, I know I'd have that type of reaction because it would happen so quickly after you eat it. Well, there's a reason why that doesn't happen sometimes. Imagine you eat a histamine reactive food right here, and it causes a symptom right there. You can eat a food and have a delayed reaction to it right here that can cause the exact same symptom right there. So if you don't feel well tonight after supper, right now we don't know if it's what you ate at supper, what you ate yesterday, what you ate 3 days ago, or what you ate last week. So the way we figure these histamine issues out are we identify the delayed ones. Those are the ones affecting the cytokines that we've been talking about. If we get rid of those, and then you're still having symptoms, quite often they're going to be acute onset, rapid onset, short-lasting symptoms, and you can start to do a food journal in reverse to see what you ate just before that. So you can see how these two types of reactions, they can mask each other and hide underneath each other. A simple summary of this process, you eat a food today, it bothers you 3 or 4 days later, you won't figure that out, so you're going to keep eating the food over and over again. The food reactions are unique to you and you alone. It's not necessarily going to be a food that you think is bad because the internet told you it's bad. It could be a food that the internet is telling you is healthy for you. This is where a lot of the confusion comes from our diets with respect to inflammation. So why do we have such a hard time finding this? The delayed response beats every test you ever tried to do to figure it out. Standard allergy tests, the scratch test, they're meant to identify the histamine reactions, the quick reactions. They're not meant to identify what we call IgG and IgA reactions, the delayed mechanisms. So you can have a negative scratch test for a food and have a positive reaction to it from a delayed point of view. People say, well, I ate that food and I felt fine. Well, the delayed reaction, if you eat a food today, it might not bother you till tomorrow. So you eat a food at lunchtime today, if you feel bad tomorrow, you're not going to think it was the food you ate today. So the delayed reaction masks and covers that up. People say, I'll just do a food journal and I'll figure it out that way. Well, you can see why the delayed reaction will confuse that. If you eat a food today and you have a reaction next week, how do you know what it was you ate in the last week that caused that reaction? And you might have 2 or 3 different foods causing 2 or 3 different types of reactions at different time frames. So food journaling for the delayed reaction is very difficult and quite often it's not useful. And people say, well, I'll try cutting that food out for a few days and I'll see what will happen. Well, if you go back to the vaccine reaction, you get a vaccine today, the antibodies don't peak for a week to 2 weeks. So if you eat a food today that has that type of response, if you give that food up for a few days, it's not going to clear in that time frame. So you'll think that food is okay and you'll keep eating it. So these different types of issues are what confuse people with respect to these delayed allergies. So in many of my videos, I talk about my own situation. I have psoriasis. It's an inflammatory autoimmune skin condition. And before I was a naturopath, I treated it just like everyone else does, steroid creams and things like that. Well, through this whole process, I figured out that my reaction is actually to rice. Rice is what triggers my inflammatory skin problem. I did an ELISA test for food sensitivity. Some of the things that I identified, gluten, rice, pepper, cinnamon, ginger, and turmeric. And of all of those foods, it was only the rice that caused my skin problem. Now, rice typically people think of as one of the most benign foods you can eat. When your pet gets sick, you feed it a rice dinner. This just goes to make that point that just because something says it's healthy for you doesn't mean it's going to be healthy for you. So I've been a naturopath for 26 years. I've treated tons of psoriasis patients. And I've seen literally most foods on a person's plate cause those types of reactions. So it's not always the common and usual suspects that people read about that are causing these types of issues in people. Another point to make here is ginger and turmeric. The issue I have when I use those, it's a stomach issue. But if you go to the internet, what are ginger and turmeric good for? They're good for inflammation and for stomach issues. Well, if I eat those, I don't feel well. So our inflammatory food reactions are unique to each of us and each of us alone. So why these generic diet plans and suggestions on the internet often fail to help? The generic anti-inflammatory diets are built to population averages. They're not built to your unique genes and DNA and immune system profile. Generic healthy may not be healthy for you. Elimination diets, they often focus on these usual suspects and not your actual culprits. And quite often it's to components of foods that you don't think. Inflammatory food reactions are actually to the proteins found in food, not fats and sugars. Now, fats and sugars can cause lots of other problems for us, but they aren't the primary inflammatory trigger. It's a protein issue. Those receptors on the white blood cells are protein-based. They can only bind and hook to other proteins. Elimination diets aren't done long enough to allow the antibodies to fall. People say, I gave a food up for 3 or 4 days, it didn't help. Well, that doesn't mean that food wasn't a problem. We sometimes have to extend the elimination diets for this delayed allergy process. They're not done strictly enough. Someone say, well, I'll cut that food back. I won't have cheese and yogurt and butter and ice cream, but I'll still have a little tablespoon of cream in my coffee once a day. Well, if someone's allergic to milk, it's like saying to a kid with a peanut allergy, don't have a lot of peanuts every day, just 1 or 2 will be fine. Allergies don't work that way. That vaccine response for 10 years for a tetanus shot is about a half a milliliter of vaccine. So everything in moderation typically doesn't work very well from an elimination point of view for food allergies and food sensitivities. And this is an important one. When people avoid these foods and they feel better, we have to challenge the foods and put them back in the right way to identify which are the actual culprits. So when I showed you my allergy test, there was lots of foods on there that showed up as responses, but only rice and a couple of the spices triggered my responses. The others didn't cross-react with any of my tissues. So we take these foods out until you feel better, and then we challenge them to see which ones actually cause cross-reactions. So that challenge process needs to be done correctly. Another way to think of these generic diet programs on the internet, they're kind of like buying a lottery ticket. If you happen to buy a program, and if the program happens to fit your immune system, it's kind of like you bought a lottery ticket and you won. If you do that diet, it should clear everything. So you'll get up and scream to the world, I had this problem and I did this diet and it cured me, so it'll cure you. Well, the next 100 people that do that program with the same condition could have completely different food profiles. Sometimes we buy those programs and they work. It's wonderful. I'm not saying that doesn't happen. But when people try those programs and it doesn't work, it doesn't mean food isn't part of your problem. You just might not have got the right program for you. So we need a structured approach to figure this out. The random sort of haphazard approach doesn't usually work for the reasons we just talked about. First step is we have to identify all your unique and individual inflammatory foods. There's different ways to do this, elimination diets. Sometimes there's some testing options that are available, but we have to identify those foods correctly and get them out of your system. Step 2 is we have to remove them, but we have to remove them long enough and strictly enough to see the symptoms improve. Before we start to challenge foods, we actually have to be feeling better. So the elimination diet process has to be correct and it has to be done long enough. Once we take those foods out and we feel better, we have to challenge the foods the correct way. We have to take into account the delayed antibody response when we go to challenge these foods. You don't eat one food one day, another food the next day, another food the third day. Because on the 4th day, you don't know which of those foods the first 3 days caused the problem. So we have to challenge foods individually. We have to do them for long enough periods of time. And then if we react to a food, we have to take it out long enough to feel better before we challenge the next food. So there's some really important algorithms you have to follow in there. The ultimate goal with the challenge, though, is so you don't end up restricting a whole bunch of foods you don't need to restrict. When people do elimination diets, they may avoid 10 or 15 different foods. And if they feel better, they may think all 15 foods are causing the problem. It may have only been 1 or 2. Now, you will have much better success long-term if you only have to focus a diet on 2 or 3 foods than a list of 15 foods. So the elimination diet is really important. Feeling better is important, but challenging the foods the right way to get that information is where you're going to come up with a feasible long-term plan to manage this. After all of that, and especially as we get older, sometimes we have to go in and do some repair work. This is where people can start to look at leaky gut repair, gut flora balancing, things like that. Now, most people in the natural health world, they tend to jump in at this stage right here. They have issues, they've heard about leaky gut, they've heard about probiotics, they go in and they take those things. But if you don't address these first 3 steps up here, it's kind of like you're putting paint and spackle on the wall, but you're not getting rid of what's damaging the wall. So the order here has to be done properly as well. Now, an important caveat down here, talking about these types of food restrictions, elimination diets and things like that, with someone with a disordered eating history can be extremely harmful. Those issues need to be dealt with appropriately with a physician and a healthcare team that can manage that. Talking about food restrictions to eliminate inflammation, to help with mood and anxiety disorders, if we're talking about eating disorders here, the food restrictions can actually worsen the mental health disorder. So this type of work is not for those types of cases. That's really important to understand. So 5 quick questions about your mood. Because your mood or anxiety issues, they show up on an average day for no reason at all. They come and go fairly quickly, or when nothing is wrong. That can suggest a possible inflammatory component. Does it come with other health conditions or other inflammatory issues, gut, skin, joints, etc.? You get some of these fast surges that we talked about. You're feeling fine, and then right out of the blue, you can go into some deep, dark holes, and then just as rapidly as you went into it, you can come up out of it the other side, and then life is normal again. Has the current work you've been doing, therapy, counseling, and some of your medications, have they been helping, but not completely? Could there be improvements in terms of the improvements they're offering? And after you've had all the tests done, the blood, the lab tests, and things like that, if they've all come back normal, and you still don't feel normal, these things can be suggestive of some inflammatory process that might be going on. If you've answered yes to several of these, there's a really darn good chance inflammation could be something worth looking at for your mental health picture. So where do we start? Where do you go from here? All the information that we talked about in this video, research supporting all the claims, is found in a book called Anxiety, Depression, and Inflammation. The link is in the description. This provides all the same explanations, but in greater detail with research supporting these claims. That's a good place to start. Next, I would download the free guide that we've mentioned a couple times in the video. The differences between food intolerances, food allergies, and food sensitivities. The technical differences between these types of food reactions can explain so much in terms of why people struggle figuring out their chronic health conditions and how it relates to their diet. This is the first work I do with every patient I see in office, whether it's an inflammatory case or not. We have to have all the quirks and causations associated with their diet, with their health conditions, sorted out before any of the other repair work can start to work effectively. So please download that free guide. Now, in terms of working through these food issues, it's best to do it with a practitioner who's well-versed in these types of reactions, a functional medicine practitioner, a holistic nutritionist, a dietitian, a naturopath. When it comes time to create elimination diet protocols based off your unique genes and physiology, when it comes time to challenge the foods to figure out which foods are the actual culprits, there's many parameters in all those little processes that are critical to understand and critical to follow. So it's best to find a practitioner to help coach you through all those. That being said, quite often these practitioners aren't accessible to everybody, either through geography or finances and things like that. So I've created an online program, how to figure out your ideal anti-inflammatory diet. There's a link in the description below that takes you to a page that describes the whole program. Basically, it talks through all the important critical background information, some of which we've talked about in this video. It talks about the elimination diet protocols and the food challenge protocols. It gives some hints and suggestions as to how to construct these elimination diets. It talks about food sensitivity testing. It talks about repair work that we can do after we identify and get rid of the inflammatory foods in our diet. The free guide I mentioned earlier is actually a summary of the first module of this course. So if you don't have access or accessibility to a practitioner to help coach you through this, there is a way to work through it. This course might be able to help you in that regard. So have a look at the link in the description for that. Now, I've given several cautions through this video. This investigative food work isn't meant to replace conventional medical care for health and anxiety and depression issues. There's nothing here that will replace good psychological therapy, cognitive behavioral therapy, or your prescription medications with your doctor. This investigative work can be done in conjunction with that. Nothing that we're talking about here has to interfere with any of those therapies. But if you're getting partial or incomplete results with those types of therapies, this may be able to compound the effectiveness of them. There's absolutely no harm and all kinds of potential benefit in terms of getting these things sorted out. So let's get started trying to figure out what your race actually is. Thanks, and we'll see you in the next video.